Well, the rain did not stop tens of thousands of Kaiser Permanente nurses and healthcare workers across the state and right here in San Diego from hitting the picket line today. It's a 5-day work stoppage right now. It affects hospitals in California and Hawaii.
CBS 8's Kelly Hessedal joins us live from the Kaiser San Diego Medical Center in Kearny Mesa. Kelly, this is day one of the strike. What can you tell us?
Well, day one has been loud, it's been cold, it's been wet, but people are in pretty good spirits. You know, they're very determined. If you take a look here behind me, you can see there's still quite a few people out here standing out here in the rain. They've been out here for hours. Now, higher wages are one thing that they're fighting for. Here's what one healthcare worker told me.
When you have brand new nurses, brand new PAs that get jobs here, they can't afford to live in San Diego. San Diego is one of the most expensive places to live in the country. So if Kaiser's worried about retaining their employees, how are they supposed to stay if they can't afford to live here?
And that was Donnie Cobbler, a physician assistant at Kaiser for more than a decade, who says because staffing levels aren't where they need to be, they're constantly overbooked. He says there just isn't enough staff to handle the volume of patients they see on a regular basis, and people are stressed. The wind, the rain today, it didn't stop these workers from hitting the picket line. People brought their kids, their pets out here. They say they want a fair contract.
At the end of the day, they have billions of dollars on hand. And, you know, they're paying these scab workers $8,000 a week when they could have been taking us serious and putting those profits towards their patients.
Now, Kaiser, meanwhile, is pushing back against what they're saying, particularly when it comes to the claim that they don't pay enough. A statement reads in part, quote, Alliance represented employees currently earn on average 16% more than peers elsewhere. Our latest offer increases their already above market wages by an additional 21.5% over the 4-year contract. So back out here live, Kaiser goes on to say that if they were to go above that 21.5% increase, they would then have to pass that cost on to their patients and raise their rates. Now, all of their hospitals, all their clinics will remain open over this 5-day work stoppage. They say it should be business as usual. Anna and Marcella.
All right, Kelly, but where do negotiations go from here? Where are both sides at when it comes to being at the bargaining table?
Well, at this point, it's unclear when they're going to return to the bargaining table. They just met last Friday. That was the last round of negotiations. It's unclear if Kaiser actually showed up for that round of negotiations. But, you know, this has been going on since this past spring. There have been hundreds of negotiations and meetings across California as well as Hawaii, and still no deal yet.
All right, and all these patients wondering, what's it going to be like when I get to my appointments maybe this week, Kelly?
Right, especially those elective ones. All right, we'll continue following it. Thanks so much, Kelly.